Hello, I'm Dr. Marla Shapiro, and I sit on the Board of Trustees of the International Menopause Society. And today, we are thrilled to be joined by our president of the International Menopause Society, Dr. Rossella Nappi, who needs no introduction. Welcome, Dr. Nappi. We are so thrilled to have you join us to talk about World Menopause Day.
To everyone, thank you, Marla.
So let's first talk about the theme, which is lifestyle medicine. What do we mean when we use the phrase lifestyle medicine?
Style medicine includes a series of principles that contribute in general to maintain optimal health and to prevent, treat, and even reverse chronic illness. And this is true across all life stages because lifestyle medicine targets the pathophysiological basis of many conditions and disorders in medicine.
You're so right. And while we're talking about women's health, many of these areas can be applied to health in general. So let's start with the 6 different pillars that have been identified. Let's talk about the first one, what we eat and healthy eating.
Yeah, the first one is diet, healthy eating. We know in general that healthier diets are linked with lower risk, for example, of heart disease, type 2 diabetes, and some cancers. And ultra-processed foods are associated with higher risk of heart disease, mental health issue, and even, unfortunately, early death. Diet can be of different types, and we identified in the literature different schemes. I'm Italian, and I have to say that first on my list is Mediterranean diet. That is the best studied approach, rich in vegetables, fruits, whole grains, olive oil, very important, nuts, and fish. Then we can have some kind of modification of the Mediterranean diet, such as the DASH diet, that focus the attention on reducing salt, and this is very, very important for lowering blood pressure. And after, we have other dietary patterns that can be considered, but we have less data. For example, nowadays, we are talking in endocrinology about intermittent fasting for controlling cholesterol, blood pressure, and even insulin resistance, but we still don't have enough data in menopausal women on the long run.
You know, one of the controversies that we have in diet, Rossella, that comes up all the time is alcohol and whether there is any safe limit of alcohol. And we've certainly seen the World Health Organization evolve over time to really talk about risk when it comes to alcohol. But let's leave that a little bit when we talk about substance abuse. So let's focus now just on the healthy eating. So aside from the DASH and aside from the Mediterranean diet, which really have the most data available, anything else that we want to leave our physicians and healthcare practitioners with?
For menopause is extremely relevant to care about bone health, and therefore we really need to be sure that patients and women take at least 1,000 international unit a day of vitamin D, and have a diet that has a range of 700, 1,200 milligram day of calcium, because this is very important to support the bone strength and reduce fracture risk.
So the next thing that we identify, if you look at the World Health Organization, almost smoking has been replaced by our sedentary lifestyle and the fact that we don't exercise. So what about the role of regular activity and menopausal health?
First of all, in general, we have to consider the benefits of physical activity in terms of improving cardiovascular health, body composition, and bone strength. Remember as well, Marla, that physical activity reduces inflammation, and therefore it's really a natural antioxidant. We know, for example, that physical activity can contribute significantly to ease the most relevant symptom of the menopause, that is vasomotor symptoms, because it improves the ability of the body to thermoregulate. And it's also very important to keep in mind that physical activities support better sleep, mood, and mental health. So women, they feel stronger and more resilient. And it's very important to keep in mind that also when women look at themselves and they feel well and fit, they have also a better mood and they feel more feminine in general. And so they embrace better this very important chapter of their life, that is menopause.
I think also one of the things they want to point out is that we worry about muscle wasting as women get older. So building muscle and decreasing your risk of fall and stabilizing also will decrease your risk of a fracture, which is life-changing.
You are absolutely right. And this is the reason why the best evidence on the types of exercise were revised in our white paper this year. And we really need to have a mixture of aerobic exercise, like, for example, activities such as walking, running, or cycling, together with resistance training. So by using weights, resistance bands, for example, or doing some kind of yoga or even Tai Chi, really this technique, they are able to build up lean muscle, increasing bone density and even lowering overall blood pressure and improving insulin sensitivity. So it's the combination of different activity that can make really a difference for women health and risk factors at midlife.
Let's go on to that third pillar. And this is a pillar that I'm sure in your office you hear as much as I do, starting in perimenopause, difficulty with sleep. But why is sleep so important to address in our perimenopausal and menopausal women?
Sleep is really essential for health and well-being, but during menopause it's even more crucial because we know that hormonal changes, but also the night sweat and vasomotor symptoms occurring during the night, they can interfere significantly with the quality of sleep. And also we have to keep in mind that women, they are most sensitive to stress. And so this is the reason why they have some difficulties in relaxing at night and having restorative sleep. The importance of sleep is tremendous because we know that when the sleep is disrupted, we affect memory, attention, and concentration. So we feel fatigue during the day and we are in low mood. But keep in mind as well that nowadays we believe that really having long-lasting sleep problem in midlife may increase the risk of cognitive dysfunction in the future. So it's very, very important for both emotional and cognitive health in women.
And the physical well-being that is associated with loss of sleep, increased cardiovascular disease, obesity. There are so many other spill down effects for a woman who is not getting restorative sleep.
Absolutely right. Think about that a short sleep duration, for example, less than 6 hours per night, is particularly risky for midlife women. These data have been demonstrated in a fantastic longitudinal study that linked the quality of the sleep in terms of number of hours and in terms of restorative sleep or not, with many parameters such as glucose control, insulin resistance, and other aspects of cardiometabolic health.
So one of the pillars I think often we don't ask about, and it's something that women may not self-disclose, the idea of risky substances in menopause and risky
So
substance use.
That's true, Marla. And this is very crucial. Also in terms of prevention of the menopause, because for example, a lot of doctors, they don't know that smoking accelerate, for example, the onset of menopause and worsen significantly the number, but most importantly, the intensity of vasomotor symptoms. And it's the length of time a woman smokes that has more impact on health than the number of cigarettes smoked per day. This is very, very important to remember. And when we stop smoking, we reduce right away the cardiovascular risks. And as you know, a lot of women across the menopause, they are afraid, unfortunately, that when they stop smoking, they gain body weight. But we really need to counsel them on lifestyle medicine and say, okay, you can compensate increasing a little bit physical exercise, following a diet. So this is our role as healthcare providers.
And aside from smoking, again, I'm going to bring up alcohol because, for many women, this often is a concern and becomes a slippery slope in terms of how much alcohol and how frequently you're drinking, and recognizing things have changed in terms of risk of breast cancer, other cancers, cardiovascular health.
Absolutely right. And also, women should be aware, and even doctors, because this is the dialogue between the healthcare provider and the woman, that alcohol during the entire reproductive life disrupts hormonal balance and make estrogen more available into the circulation. And this is the reason why alcohol can influence reproductive health and breast cancer risk, as you said. But also, we have to remember that heavy drinking, that can be common in women. They have also emotional problem, difficulty to cope with all the different aspects of their life. Heavy drinking is linked to earlier menopause, bone loss, and high risk for fracture. This is the reason why we always have to include this information into our medical history with our patient.
So you mentioned stress, and that brings us to the fifth pillar that's been identified, and that's emotional health and emotional well-being.
Yeah, do you know, midlife can be a stressful time by itself because for many women it's very difficult to balance family responsibilities, careers, and all the health change occurring across the menopause. And there is a problem with the work-related stress right now. Women, they feel less in control when they are uh, during their life. And this is the reason why, unfortunately, mental well-being is so much affected. But we have to remember that when we are stressed, vasomotor symptoms may be more intense, and we are negative, and we are not able to really put in motion all the resources that we can have. This is the reason why we really need to learn little tips and tricks, and we have to teach to our patient that some techniques such as mindfulness, relaxation, and stress reduction, they can have very, very important role in reducing symptom severity and improving resilience. We really need to embrace the change.
Let's go on to our last pillar, which is supportive relationships, and the broad definition of what a supportive relationship is and why that actually does have a role in menopausal health.
You know, supportive relationship means being social connected, and you can be connected to your partner, to friends, to the people that are meaningful to you. And remember, we have to learn at this time of our life to be together with people that really are good for us. We feel well with them, And it's a rewarding experience to stay with people. Sometimes it's not easy because, you know, life is stressful by itself, but we really need to focus our attention to feel more protected in our life. And when we stay with people and we are not isolated and alone, it has been demonstrated clearly that we eat better, that we do exercise, that we have less depression and anxiety and other mental health challenge, but also that we have less risk for cardiovascular disease, metabolic syndrome, and disability, and we don't have falls, and therefore we risk less fracture. So it's really protection overall in terms of physical, emotional, and mental well-being.
I think that so many people are surprised that the single biggest predictor of healthy aging is exactly that, social connectedness. So now you've done an exquisite job of outlining 6 pillars. And now the challenge, I think, that you're giving all of us as healthcare practitioners who see women is to ask about these 6 pillars, make sure we incorporate these 6 pillars into our questionnaires and into our discussion to really be able to empower women that there are so many areas in lifestyle medicine, as you've identified, that can significantly influence menopause in a very positive way.
You are absolutely right, Marla. I think IMS really believes that lifestyle medicine is a must-have in the menopause toolkit, meaning that lifestyle should be really part of the medical history, and it's not so difficult, you see, because asking about diet, exercise, sleep, etc., it's really part of our interview. We really need to do in a very simple and positive way. So we don't have to scare people, don't. We really need to improve the ability of doing, okay? You do for yourself because this is the best way to empower women in a very balanced way, meaning that, of course, we can have hormonal or non-hormonal strategies, but you can do something for yourself as well. And this is very, very important. It's not just giving drugs to women, but really empowering them to be part of the process.
And I thank you so much because that empowerment is based on education. And I think as healthcare practitioners, we have these new 6 tools to remind us to reinforce these healthy messages that is something that is doable to change the course of outcome in midlife health. Thank you so much for joining us today.
Thank you, Marla. You're great.